Hello and welcome. I'm Lisa Sievers, Pediatric Clinical Instructor.
And I'm Cherry Hicks, Director and Clinical Course Coordinator for the Pediatric course.
Today we're going to do an orientation and a tour of the Pediatric Simulation Room. As you look around the room, you'll see that we have a large full-size bed for a child mannequin. We have an electronic medication cart. We have supply cabinets and drawers for all the things that you'll need to do simulation. We have 3 cribs in this room, each with their own mannequin. One of our cribs has a safety bubble on top. We have a Braslow color-coded crash cart. We have an electronic vital sign machine. And we have an isolation cart.
Let's start our tour at the hand washing station. We have our towels, soap, and a fully working sink. Then we come to our sharps container. Now let's take a look at the bedside table. Each bedside table operates a little differently. This model you push in to pull up, push in and to pull down. Now we'll move over to where the oxygen, air, and suction is on the wall. We have our suction, air, and oxygen. Then we have our bed. The bed controls for your patient is on this side. Buttons, and on the outside they mirror the patient buttons where your knee, your bed, and your head. You may also note that there is a level that shows you what angle your patient's bed is. The side rails are controlled by a green button on the side. You would push the green button, push down, and it goes down. Always remember to keep your side rails in an up position. At the end of the bed you will find the brakes. Green is to loosen the brakes and where you can move. Red is to initiate the brakes and stop. All the controls are controlled here at the end of the bed. The red button initiates. If you had a CPR code, you could press this and your bed completely flattens out to enable you to initiate your CPR at that time. Now let's take a closer look at some of the other features this bed has. We have the weight, you have your main up and down movements, and you have a lot of other interesting features. You have lights, where if it's at night you can come in. You can put a bed monitor for your patient if they're getting out of bed, and have other special codes for you. Now that we've seen the main controls on this bed, let's take a look at the other beds in the room. Ms. Sievers, can you show us the cribs?
All right, well here we are over at the crib. I'd like to show you what things we have over here. First you'll see that we start with a wash station with a sink, the towels, and the soap, just like we had on the other side of the room. And we also have wall suction, air, and oxygen available for you. When you look at the crib, the first thing you're going to notice is this large red handle. You have 4 side rails that each work independently. The large red handle you're going to squeeze, twist, and it will come down. There are different predetermined stop points for you. This is the first one, and then our second one, and then all the way down to the bottom. In order to raise and lower the head of the bed, you need to come to the head and find this little red knob underneath the bed right here. This is a manual knob, so if you pull up on it and then gently raise the head of the bed like that, and just the reverse, pull up on the knob and gently lower the head of the bed as well. To raise up the side rail now, anywhere you'd like, just gentle pressure will bring it straight up. Okay. We have 2 gates, one at the foot and we have one at the head. You have 2 red buttons right here. You're going to squeeze these together and open the gate. This will give you accessibility to the foot of the bed. And the same thing at the head, squeezing the red buttons. Okay. And this might be necessary over here. When we go to the base of the crib, you'll notice there's 3 large pedals down there. The largest one is your brake. The red side is when the brake is intact and it's down. When you push to the green side, then you can move your crib. Okay? The second pedal raises the height of the entire bed. And this might be necessary when you're providing cares for your infant for increased accessibility. The last pedal does 3 different moves. It's going to lower the bed, and then it's going to lower the foot, and it's going to lower the head. So there's our lowering, and then this lowers the head. All right, let's move to the foot of the bed. So at the foot of the bed, you'll notice that big red handle again. Squeeze, twist, and bring it down. Okay. This is an electronic crib, so you can weigh your infant in the crib right here was where you will turn it on. You have 2 IV posts right here for stabilizing IVs. Over on the far side of the crib, you'll notice that we have the same pedals at the base of the crib for controlling the height of the crib and your brake. Here's our bedside monitor. Each of our beds has an electronic bedside monitor where you'll have your vital sign readout. We have our sharps container and our glove dispenser. Well, that's it for the crib. Let's go and talk with Mrs. Hicks about the electronic medication cart.
This is our electronic medication cart, which is movable. The screen here, desk with the manual, keyboard, mouse, and then you have your drawers where the medications are. Next, we're going to take a look at our medication cart. Miss Sievers?
The last thing we need to go over is our supplies in the cabinets and drawers here. We have 4 cabinets and we have 4 drawers. You'll notice on the outside of every cabinet there is a yellow sheet here, and it lists all the equipment that's found in that cabinet for you. Then when you open the cabinet, you'll see that we've also labeled all of the items in each of the cabinets. So hopefully this is going to help you find the equipment you need quickly and efficiently. Most of the things in this cabinet have to do with tracheostomy care, some solution, saline and water, and some IV medication administration. Going on to the next cabinet, you can see that we have feeding supplies, we have oral syringes, we have dressing supplies, gauze, and then we have extra gloves, paper towels, and things like that, as well as formulas in this cabinet as well. Moving to our lower cabinets, this is a really important cabinet. We have IV fluids here, so when you need a new IV bag, this is where you're going to come. We also have suction equipment here. We have catheters, we have bulb suction, and we have some feeding tubes that you might need to insert. And our final cabinet, we have linens. We have diapers. They're always important in the pediatric room. We have diaper wipes, and we have some extra clothing for our babies in this cabinet. All right, now our drawers. Again, our drawers are each labeled with a yellow sheet of paper and the list of equipment that's in that drawer. This first drawer, this is our respiratory equipment, and you'll see in here that we have each of the pieces of equipment labeled as well, and hopefully that'll make it easier for you to identify what you need. The next drawer is medication equipment. We have saline, we have sterile water, calculators, the all-important alcohol wipe. Our third drawer is our IV start supplies. We have sterile syringes in here of multiple different sizes. We have tape, and we have all the equipment you're going to need to start an IV. And our last drawer, this drawer contains equipment for taking vital signs. We have your blood pressure cuffs, we have thermometers, we have pen lights and tape measures, and we also have some reflex hammers just in case you need those. Well, that's it for our supplies. Well, that's it for our orientation to the Pediatric Simulation Lab. I hope it's been helpful for you.
Thank you for watching.
That was really fun. I hope it's helpful.